All right, so good afternoon, everyone, and welcome back to We See You. And for those of you, it's your first time joining us today. We See You stands for we support, educate, and advocate for you. So today we are most excited to have Shayla with us, and we are going to highlight National Women and Girls HIV and Awareness Day. We do realize that that actually took place next week, but we wanted to last week, but we wanted to make sure that we keep that awareness day in observance and that we continue to highlight that. So my name is Kelsey. I am the EHE coordinator with Lifelines Counseling Services, and I will let these beautiful ladies introduce themselves to you.
My name is Chanel Chapman. I am the EHE community educator at Lifeline Counseling Services.
Good afternoon, everyone. I am Ashley Rocker. I am the EHE peer navigator at Lifelines Counseling.
Me. Hi, good afternoon. My name is Shayla Knighton-Black, and I am the manager of monitoring, evaluation, and learning at Hands United. And Hands United is the capacity building branch for the Latino Commission on AIDS. So I don't know if the people that are listening today are familiar with the commission, but we are an organization. We are based in New York City, and we've been around since the 80s, since the beginning of the epidemic, working to address HIV in the Latinx community. We have expanded and we work to really talk about and try to, help end this epidemic within communities of color. Specifically Hands United, we are located throughout the South. We serve the southern region of the United States. We go all the way over west to Texas, down to Florida, and up until Delaware. That is our region. So anywhere in between that is the states that we would serve. And we just provide capacity building and technical assistance to agencies in those regions. We recently hosted a PrEP Institute in Alabama, which is where I met these lovely ladies. And I am very happy to be here today. Thank you for having me.
Thank you again so much, Shayla, for being here. And for those of you who are joining the live today, we definitely want to hear from you. So if you have any questions or comments, please do not forget to make those known. We'll get those in the chat and we will make sure that we address those. So we're going to just jump right on in. You ready, ladies?
We are ready.
Let's do it.
All right, Shayla. So the first question I have for you that I'd like for you to speak on is, what are the main needs and gaps in the area of prevention and education for women, especially Black women and other women of color that you have found?
So in my experience, I'll just give a little background about my experience. I've worked in HIV for a little over 10 years. I started in college as a peer educator, and then I've worked at community-based organizations. I've also worked for health departments, statewide health departments, and now I work in capacity building. And so in my experience, I found that the needs of women are not met in many times. We have a lot of our health issues that are not met. I think the most pertinent thing that would help us engage women more is just more education. I feel like there is a large disconnect with education amongst women, especially when it comes to sexual health. I know we talked a little bit about this during the PrEP Institute, but what I have come to found as a woman myself, and I have many women in my family, women oftentimes we kind of put ourselves last. We are the last person to, go to the doctor if something's going on. We're going to put it off, especially if we have like a family and children that we need to think about. We're going to put ourselves last. We're going to think of ourselves as, I'll check on it later. I'll check on it later. And I think that is one of the things that we need to work on, is educating women more to really take initiative into their own health outcomes and their overall health. I think that's a major part of it. Also, we need more representation, especially for women of color. We don't see a lot of, marketing with women of color, cisgender women of color as well, marketing towards that population to let us know about HIV prevention methods. I think it's kind of, people like to say, oh, HIV is forgotten epidemic, especially since COVID. And I mean, largely that is true, especially within certain populations. I think a lot of women have kind of put it to the back burner, like maybe they're not at risk, or that lack of self-perceived risk is there as well. So that's also where the education piece comes in, just more education, more representation for women, especially women of color.
Very good.
Yeah,
And so,
if I could add to that, I think advocacy is a huge component of that as well. So for those, women of color that don't feel like they could speak up for themselves, even, if it's a doctor's visit, if they feel like they're not getting what they need from their medical professional, I think just kind of providing that support for women to know that they can advocate for themselves. And like Chanel has stated in the past, feel free to terminate that relationship with that medical professional if you are not getting what you need, or if you feel like you are not being treated fairly. So I think advocacy is a huge part of helping people find their voice and knowing that you can actually say something.
and so I'm gonna go off script a little bit because you all brought up advocacy. What role do you think education as far as cultural competency and the healthcare professional, what role do you think that they have, or that need has, and how can we include that in part of our conversations with healthcare professionals, cultural competency training, and the bringing in of these types of questions and conversations with our patients, or with their patients?
So one thing that we do at Hands United is we're very focused on cultural responsiveness. And so when we talk about that and we do TA about that, we really let people know that it's important. The cultural aspects of someone's life is very important to them. And when it comes to women, especially Black women, I'll speak on Black women because that's what I'm most familiar with. I am a Black woman. I'll say, there are a lot of cultural things that go on, especially when it comes to Black women, that I think a lot of people in medical professions may not take into account. We have a history of medical distrust and mistrust.
Right, right.
That has
Right.
gone on for decades. Like, it's something that it happened. It still is happening. If you look at,
That's
of
right.
course, maternal mortality in the
Right.
United States, it's very dangerous to have a child, especially as a Black woman in the United States.
Right. That's right.
Also, when it comes to pain management, anything at all regarding Black women when it comes to healthcare, there's going to be from coming from us as Black women, there's going to be a hesitation there because of things we've experienced. I mean, I'm 35 years old and it's 2022. I've experienced things that made me distrust the medical community in my own life. So it's like there are things still happening. And I think overall there needs to be some more cultural responsiveness training, especially in the medical profession, so that people can understand, like, we are not coming from a place of not wanting to go to doctors. I feel like in the Black community we have this stereotype that, oh, we don't like to go to the doctor, or we don't take care of ourselves. Okay, well, along with that comes wounds. We have wounds from things that have happened to us in the past,
Right.
our ancestors. In Black communities, like, shared experiences, and like you hear stories from your grandparents or your great aunts. We have things that are passed down to us that are told to us from people's actual experiences. So that already imparts a little bit of a bias on us when it comes to healthcare. We're already looking at it a little bit apprehensively. And then when we actually go into a healthcare setting, if that is perpetuated, even in the smallest bit, that automatically makes us repulsive of the healthcare setting. So I think when it comes to cultural responsiveness, it's the job of our providers and our healthcare field to understand those instances in our history and understand why we have apprehensiveness, and also acknowledge that, and kind of take hold of that and take ownership of the responsibility as a healthcare. The Hippocratic Oath says that you're supposed to care for those who come to you for medical care. Take that into real consideration, even when it comes to just how people think or perceive the healthcare settings.
Very good, very good. Also, as far as collaborating with our city and our local government, how can we create situations, policies, procedures, and things of that sort to help the city to know where we stand as far as the epidemic? I know, like in Mobile, it's an epidemic. It's a great number. And a lot of people aren't aware of the number of women, especially Black women, that are particularly affected by HIV. So what is it that or how can we include or have this conversation with our local officials and partner with them to not only make this known, but to do something in conjunction with them to help to end the epidemic?
So I think we mentioned it earlier, which is advocacy. You have to go and be and represent the needs of what our community is looking for. If they don't hear about it, if they don't know about it, they won't be able to act on it. And I truly, in my experience, I have found that a lot of people don't know about a lot of things regarding HIV, especially if they don't have any perceived risk or if they don't feel that they may encounter that in their own lives. It's not something that is in the forefront of their minds. A lot of people are not thinking about HIV, especially when it comes to politics, especially now during COVID. Like, that is, when we're talking about health, that is the forefront of our health concerns right now. It's COVID and making sure people are vaccinated and wearing masks or not wearing masks, what have you. So I think that advocating and really, making sure people understand and know what is actually going on. If they don't know the plight of people being affected by HIV, there's not much that they can do. And I think we really have to go and represent and show what is needed in our communities.
And I think that all goes down to numbers too.
Mhm.
Because like we were talking the other day, you can say we're in an epidemic, but if you don't have the numbers to back it up, it's like, well, are we really in an epidemic? So I think just like by providing those numbers to these people that are in places that could make these policies and procedures go through, like they need that visual, like this many people are being affected by HIV.
Right. Yeah.
Mhm. Mhm.
Yeah. Yeah. Some people are very much so numbers people.
Mhm.
And if it's not right there in their faces, it's very easy to just kind of sweep it under the rug. So like you ladies were saying, the more that we are out there, the more events we have, the more testing that's taking place. Hopefully that will kind of get their attention, because people really do, even before COVID, like Shayla was saying, there are a number of people that feel like HIV has just gone away. Now, again, I'm not sure where they thought it went. I'm interested to know, for the individuals that thought it just went away, what exactly do you think happened? But it has been swept under the rug. It's been put on the back burner, and people are still infected every day. People are still suffering. People are still walking around not knowing their status. So, like Ashley was saying, maybe the numbers. If you're able to visibly see the numbers, maybe that will be in your face enough for us to kind of to go back and look at those policies and procedures.
Yeah, people really love to see the numbers, because I remember a few years ago where that one statistic came out. I think and I don't think this is still true, but it said like 1 in 2 Black men would contract HIV in their lifetime. People were blown away, and I was like, this has been going on for a while. Like, this is not
Like,
new
it's serious.
It's serious. Like, it's really serious. And I just remember people being so completely flabbergasted by that number. And I was like, we've been trying to tell y'all this for a while now. So they do
As
love
a
to see numbers.
as a Black woman, the number that was startling to me was that we only make up 12% of the entire United States, but we're 40% of people suffering with HIV.
Mhm.
That
That's
is
alarming.
alarming.
Yeah, 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 absolutely. And then for our area, for our population, if I'm not mistaken, we're somewhere between 49 to 51% Black
Mhm.
in our area. So, you don't have to be the smartest cookie in the jar to figure out that we have a serious problem. And I'm horrible with math, but I know that's not good.
And even amongst that number of
good.
the 40%, I believe women make up 18% of that number. Black women make up 18% of that number. That's
Yeah.
a high number.
It is. It is.
That's almost half of the 40.
Yeah.
Right.
Yeah. Yeah.
Right.
So
yes.
I'm hoping the more we have these conversations, the more we make it normal, that it's okay to talk about your bodies. It's okay to talk about sexual health. It's okay to call your body exactly what it is. So our goal is to keep making these conversations normal, make them comfortable, meet people where they are. So that's the goal.
And that goes back to like the first question, like what are the needs? And it's just like letting women know that it's okay to have these discussions. Like what we've been doing lately is just creating spaces for us to have these discussions, because like where I come from, we come from a small town. So we talk about Jackson all the time, how, you have some close-minded individuals, they feel like it's not acceptable to, discuss HIV and sexual health. But it's just like getting them to realize that this is something that needs to be talked about.
Right.
And it's not going away. It's not going away until we continue to talk about it and encourage people to get tested, encourage people to protect themselves. Like there are preventative measures in place. So, to know that you qualify for those things, you are worthy of taking care of your body and your mind. So, yeah.
And it's and as a culture, the Black church has a role that it has to play, because for us the church is everything.
Mm-hmm.
And they are one of our biggest avenues as far as getting the word out. And so in doing your work, how have you partnered, or have you been able to partner, or have you found it difficult to partner with faith-based organizations for testing and these types of conversations in your work?
So I of course have run into some difficulty, especially when it comes to testing and talking about sexual behaviors at church events. But I've also had some success in just getting my foot in the door at a church.
Right.
And that, I feel like any progress is good progress. So if that means that I can, talk very briefly and very surface level about, HIV testing is important, I like to lean on, CDC data, like, okay, well, the CDC recommends that you get tested once a year. That's just providing someone information. Okay, so next time you go get your physical, make sure you tell your provider to make sure you have an HIV test when you go once a year. That's educating someone on something. And that you never know, that may lead to someone asking additional questions. I also have been lucky enough to work with several churches in the past. I'm from South Florida. And so my home church back home is a relatively large church. They are open. I've spoken at church before about, sexual health and HIV testing, things of that sort. And I've also been able to do testing at certain church events as well, like health fairs and stuff. They're open to doing testing there. And then also we have churches that really, I've experienced churches that really work with us with we have something called FERDA here in Florida called the Faith Response to HIV. And so there are a couple of churches that are really open to providing that space to talk about HIV, talk about testing, and just overall education as well.
That's awesome.
It was we worked with quite a few churches. That was several years ago. And in Tallahassee, I believe there are several churches here that when they have health fairs, they do allow like the health department or other community-based organizations to come in and do testing and also educate their congregation as well.
It's wonderful.
Have you noticed that one type of faith or one denomination is a little bit more open than the other?
I actually have worked with all kinds of churches,
Okay.
but one church that I distinctly remember when I was working in South Florida that was really open was called the Metropolitan Church, or
Okay.
MCC. So
Okay.
they were very, excuse me, they were very open about letting us provide testing and do education. In fact, we had like a weekly session that we would go to at that church where we provide, I think it was twice a month actually, we would provide testing and also education there and also pass out condoms. But I have worked with Baptist churches. I'm from a missionary Baptist church. My
Mhm.
church let me come in and speak. We've had Catholic churches. We've even had other denominations outside of Christian as well.
Okay. Yeah.
Because there is a awareness day. I'm unsure of the actual date, but there is a faith awareness, HIV awareness day
Yeah,
that
it
I don't
is.
know if it's mainstream yet, but I know it had started, and it works with all kinds of denominations to kind
Right.
of bring that education piece in.
Yeah. That's huge.
Mm,
Yeah, it
it
is.
is. Religion is very important. That's also like a door into or a pathway into the Black community. If you
Mhm.
can get in at a church somewhere,
Yeah.
and you can even in the Latinx community, because religion is also important. Religion
Yeah.
is important in many different ethnicities, and getting into a church is like one of the best ways to get into a community because people rely on the church. They trust in the church. So if you could build that rapport with a church in your area, that's like the best way to engage people in that community is getting through to the church.
Yeah.
And so we were a part of your PrEP Institute,
Mhm.
and I've read that a lot of Black women aren't familiar with PrEP and don't use it. Is it because of the unfamiliarity? Is it because of the fact that they don't want the possibility or the thought of that they may have HIV, even if they use PrEP because because they are dating and they're trying to be proactive?
Mhm.
What have you found is the reason for them not being, or for us not being receptive to PrEP as a source of prevention?
So I have found a couple of different reasons. In my professional experience, I have found that not a lot of Black women are educated about PrEP. They don't know what PrEP
Mhm.
is. And so when you tell them about it, there's immediately a hesitation because, okay, you want me to take a pill every day to prevent something that I don't think I'm at risk for? No, I'm not doing that. So it's like that was what I found in my professional life. Also, when you look at PrEP advertisements, you don't see Black women, cisgender women,
Right.
you do not see.
Right.
And so you have to have representation of the people that you want to be involved in this prevention method. And so we need representation. We had a long discussion during the PrEP Institute about how you'll see Black women in HIV treatment commercials and marketing, but you don't see Black women when it comes to prevention. Before PrEP and NPEP came around, when we talked about HIV prevention, it was condoms and testing, and that was also kind of leaning on the male or the cisgender male perspective. Is like, oh, use a condom, and that kind of created the idea that having the condom is on the male counterpart, but that's not also true. Women can also carry condoms. Women can also like let men know I need you to use a condom because I would like to protect myself. But also when it comes to PrEP, if they don't see representation, they're not going to engage in it. And then in my personal life, I talk to my friends. All of my friends are Black women. Most of my friends are Black women. And so when I talk to them about PrEP, there is a lack of perceived risk. Oh, well, I'm not sleeping with anybody gay. And it's like, okay, so you don't know what anybody is doing when they're not around you, number one.
Right.
Number two, it has nothing to do with that person's sexuality. It has to do with what you're doing with your life and what you want to do to protect yourself. And so there's a lot of lack of perceived risk. Like, and I get it. Like if I went to the doctor and I said, "Oh, they asked me questions and they deemed that I was appropriate to be a candidate for PrEP." If I didn't know anything about PrEP and they were like, "Oh, well, you know what? I think, based on what you told me, I think you'll be a candidate for this medication." First of all, I came here to get a HIV test. I didn't come here to get
Right.
any medicine.
Yeah.
Second of all, you tell me I gotta take it every day. I barely remember to take my vitamins on a daily basis. So
Right.
no, so you also like if you don't know, you have to educate, build that education, build that rapport with Black women and kind of build that bridge to let them know, like, okay, look, this is something that you need to keep in that you need to know about. And even outside of that, NPEP, how many HIV infections could be avoided if people knew what NPEP was?
Yes,
Some
yes,
people feel it's
yes.
Yes.
horrible. People do not know about that. So I think
And
we need more
since you
education.
brought that up, will you explain to the people what NPEP is and
Yeah.
Okay, no problem. So NPEP stands for I think it's non-occupational
Mhm.
post-exposure prophylaxis. And it's basically to medications that you can take after you've been exposed to HIV to prevent an HIV infection from forming. And so it is usually two pills, and you take it every day for 28 days. And it is effective, but time is of the essence. You have to take it within 72 hours of
Right.
exposure.
Right.
Even sooner is better. But a lot of people are not aware of it
Nope.
unless you've been like assaulted. Like if you've been sexually assaulted, then that's if you report it to the police, because let's be honest, there's hundreds of sexual assaults that go unreported as well. And also sexual assault can occur from somebody that you know and love. So, if you don't know about that, then you don't have access to, you don't know how to get it.
Right. Right. And actually, Shayla, most of the time when a person is sexually assaulted, PEP is not offered.
Really?
We have come to know that it is not offered. And so
Wow.
one of our main goals is to offer NPEP, and I'm just so elated that you actually brought that up because people do not discuss that.
They don't. They
It is
don't.
not. It is not offered. It is not. Most of the time, it is not offered to those who have been sexually assaulted.
Mhm.
They
And
don't. They don't know anything about it, and it's not offered.
there's like shame attack. There's a lot of shame.
Right.
Even when we're talking about HIV, period, there's stigma
Right.
attached. But especially if you've been like assaulted or your partner is, not monogamous with you, and you feel that you can't, stand up for yourself. A lot of women are going through situations like that as well. Like they don't have any way out, or they feel like they don't have any way out. They don't have any support. And knowing about these kind of things is so important for the health of women overall.
Right. That's right. That's right. Yeah. And you mentioned that, sexual assaults happen often. I mean, every 68 seconds
Hmm.
in the United States. So yeah, that's how often it's happening. And then you mentioned something a little while ago that I kind of want you to highlight again, that it's okay for women to actually carry condoms.
Yes, it's
yes.
perfectly, yes, women should carry condoms.
Yes.
That's what you should do. And a lot of in my experience, I've done a lot of, condom demonstrations, and we have the whole thing. You look at the lot number, pull it to the side, all of that. But also a lot of women don't know about female condoms. Female
Yeah.
condoms
Yeah.
are important, and they're also a way that you take your own sexual health into your hands. Um, I know a lot of women who do use them. In my experience working with women, they use them, and they take that control back from their partner.
Right.
That it's not just on them, it's also on you to protect yourself. So there's
Right.
nothing wrong with women having condoms at all.
Right.
It's
No,
very empowering,
it is.
Hmm.
and it allows you to own your own sexuality.
Yes.
Right. Right. That's a whole conversation in itself, I believe.
Yeah.
Owning your own sexuality.
Owning it.
Owning it. So I see Chanel and Ashley both writing that down. Yeah, that's a conversation in itself. What's wrong with that?
I think it's just a lot of it is just, and if I can give my humble opinion, a lot of it is just based in, how we were raised and
Yeah.
what our cultural aspects, how that informs our life. There is a model called the health belief model. And it basically is about how our outside factors in our life really dictate, what we believe about our own health. What we see and what we perceive is something that we believe in for our own health. When it comes to Black women, a lot of us were raised in the church, or we were raised with people that, it was frowned upon for a woman, and even a girl, anybody that identifies as a woman or a woman of color, to talk about sexuality or sex. That is a red flag. That is not accepted in our community.
Right.
So no one wants to talk about it. No one wants to engage in those conversations. And I think that is one of the largest issues within our communities, that we don't talk about a lot of things. We don't share these things. So there are young Black girls coming out of our community not even understanding, hey, okay, if you want to wait to marriage to have sex, that's on you. That's your choice. You can do what you want to do. It's your body. But also we have girls only thinking about the fact that, oh, I need to wait to have sex to marriage. Okay, well, if you don't wait, what do I need to do to protect myself up until that point?
Right. Yeah.
So that's something that I think we're kind of missing. We've missed the mark on that a little bit, especially with educating our girls.
Right.
And we also need to educate our girls that we don't have to share our men, and because there's a shortage, either because of incarceration or other community things. And, we have to teach our girls our own worth, and, and own their sexuality, and be okay. You don't have to share a man just to have a piece of man. A piece of man is not better than no man.
Right.
That's dangerous.
Right. Yeah, absolutely. I don't know if y'all remember the R&B group Guy. Shayla, you remember Guy?
I remember
there was Ashley. What about you?
You might have to sing the song for me.
As I get older and I think about some of those old songs we used to listen to, and doing this work, what we do, it kind of makes you just kind of dissect too many different things. Guy had a song called "You Can Have a Piece of My Love." Do y'all remember that?
I actually love that song. I listened to it this morning.
So why are only
waiting for you?
Right. So why are we only worthy for a piece of your love? Why can't we? Why can't we have? Yeah. So when we think about stuff like that, that just kind of came up when we saying that. Yeah.
We are a whole person. We deserve another whole person.
Right, that's right. And we have a couple of Facebook comments from Katrina. And she was just saying that part of our self-care, like we were saying, taking our sexuality, taking control of that is part of our self-care. So just like you're taking all of your other prescribed meds, all of the above, your birth control, all of that should be a part of your self-care. And yes to female condoms. So she is cheering for female condoms.
Yeah.
Thank you, Katrina.
Yes. So this has been a very enlightening and very much needed conversation. And I really appreciate you taking time out of your day. Ashley or Kelsey, do you have any other questions or any other topics that we may want to discuss before we sign off? Or Shayla, anything else you'd like to end with?
I'm thinking if you all have any more questions, I'm open. I'm thinking.
I don't think we have any from the chat or anything, or from our audience at this time. Was there anything else that you feel like, Shayla, you want to just kind of uplift before we wrap it up?
Sure. We've already touched on it a lot. I'm a huge proponent for women, taking control, taking charge of their lives, living your life out loud, however you want to live your life, love whoever you want to love, do what you want to do, because it is our bodies, it is our autonomy to choose what we do with ourselves. But as a person who works in public health and who has worked in HIV for a very long time, I want Black women, women of color, to really take care of ourselves. It's not anybody else's job to advocate for us or take care of us. When you go to your provider, when you go to your gynecologist, your nutritionist, whoever you go to, you need to advocate for yourself. You need to tell them, I need this, I need that. And if they don't want to give it to you, if they're hesitant about, or even discussing these things, then find another provider. For me personally, I have
Mhm.
all Black women providers. Every one of my providers is a Black woman. My gynecologist, my primary care physician. I'm still looking for a dentist. Haven't gotten there yet. But all of my providers I see on a regular basis are Black women, and I did that on purpose.
Yeah, absolutely.
I've done it on purpose because, and if in the event I have any children, I'm going to be, my Black gynecologist is going to be my doctor. I'm going to have a Black doula, and it's because
Come on, doula.
Right.
Yes.
it's because we need representation. We need to step up for ourselves. And if you know somebody who doesn't want to advocate for themselves, do it for them. I've done it for people. My sisters, oh my gosh, they're always calling me and asking me, can you do this for me? Can you help me with this? I try my best to help them. I say, okay, I'll help you this first time. The next time it's on you. You're gonna have to work for yourself. You have to speak up for yourself.
That's
And so
right.
if I can leave anybody with that note for our women and our girls, advocate for yourself and stand up for yourself.
Yeah, absolutely. And can I throw no judgment in there?
No judgment.
Yes.
And we, when you have another woman that comes to you with an issue, or you see them stumbling, don't judge them. Help them. That judgment, it can make or break.
Yeah.
Definitely make or break when a person is struggling with whatever they are going through. Let's stop judging each other, because and we've said this a million times before, especially as Black women, we are all we have.
Mm-hmm.
If we don't look out for each other, we're really gonna continue to be immortal. We have to look out for one another. And it doesn't have to necessarily be a Black woman that you're close to, that you have a close relationship with, in order to advocate or support or educate them. It could be anybody. So let's stop the judgment. Let's learn how to support one another.
And stop imposing our views on them. Just learn to be supportive.
Right, that's right.
And sit in silence. Just sit with them sometimes.
Right.
Sometimes all we need is just for you to sit with me.
That's
you
right.
know? And I think too that the judgment is sometimes why we aren't having these conversations, because we either are afraid no one else is dealing with the same issues that we're dealing with, or we are afraid that we're going to be judged by our sisters.
Right.
And they're going to have something to say, or they're going to look at us cross-eyed or whatever. And so we just kind of suffer in silence.
Yeah.
I speaking of no judgment, I have a friend, every time I go and vent to her, her first thing she says is, look, this is a no judgment zone.
Mm-hmm.
So we just kind of have that understanding. She's that type of friend. No matter what I tell her, she's not gonna judge me.
That's right.
That's it.
That's
the way it should be.
Yeah,
that's the way it should be. There's enough going on. So the people that have chosen to be a part of our lives need to know, like, take me as I am, love me through it, and that's it.
Right.
Mm-hmm.
You don't have to agree with it, and you may think that it's crazy, I'm crazy, whatever, but just sit with me through it and help me through it.
Right. And maybe we'll laugh about it later. But right now I'm struggling. Right. And Mary J. Blige said it best, take me as I am. I'm a music head, so everything has a music title. Take me as I am.
That's a good title though.
Right. And then we had another Facebook comment. Angela J. said, thank you all for this discussion. So thank you, Angela J., for being a part of the discussion today. All right, anybody else want to uplift anything before we wrap it up?
I just want to say, for those of you all who are listening on Facebook, please get tested. If you go to the doctor and that's not a part of your normal routine, it's okay for you to ask them to test you. There are also AIDS service organizations that provide testing, the health department, Franklin. We soon will be providing testing as well. So there are plenty of opportunities to be tested. Please get tested. Please use condoms. It's okay. And talk to your partner about whether it's a boyfriend or just a one-time thing, about their status,
That's right.
you know, because it's your life. So that's all I wanted to say.
Beautifully said. Beautifully said. And before we sign out, I definitely want to uplift a National Native HIV and AIDS Awareness Day. I think that is observed on the 20th. So this day is set in place to address the impact of HIV on American Indians, Alaska Natives, and Native Hawaiians. So to those that represent that community, just know that we are uplifting you, we are supporting you, we are here to educate if you need it, and we are definitely advocating for you. So I couldn't sign off without us saying that. Our brothers and sisters that are part of that community, just know that we are here. We have your back. All right, ladies, and of course, if anyone that is watching the live now, or that maybe will see this later, if you or someone that you know has been affected by sexual violence, again, we are a resource. If you need to talk about it, if you would like to receive any type of advocacy or counseling, that number is 251-473-7273. And if you would like more information about just all of our agency services, our website is lifelinesmobile.org. And remember, we see you, we support you, we are here to educate, and we are definitely advocating for you. All right, anything else, ladies?
I think that's it.
All right. Until next time, everybody, take good care.
Thank you all.
Bye.
Bye. Thank you.